Kia ora koutou katoa. Good afternoon. Today I will set out Cabinet's decisions on alert levels in Auckland, Northland and the Waikato, as well as signal announcements for the rest of the week. Firstly, though, I want to say something briefly about Super Saturday. We all know what it meant for vaccine numbers. 130,000 people vaccinated in one day is enormous. It was a tribute to the health staff, to the people who have been working tirelessly alongside them for months, community organisations who work so hard to support people to be there, the business community who promoted the day and provided every reason and incentive possible to be vaccinated. The biggest success of Super Saturday, alongside the lives saved, is that it reminded us all we are still a team. That through this really hard few months, if we have a job to do, we will rally to do it. Today we are making decisions that are based on the here and now, alert level decisions that are based on case numbers and what we can do safely. And this has been primarily affecting Auckland, but also now the Waikato and Northland. We know that in the future, we cannot ask people to live week by week, not knowing when things will change or how to help things speed up. We know that needs to change, and we have a plan on how. While the announcements today will be about the next few weeks, on Friday, we'll provide the detail around the system we will use to protect ourselves in a highly vaccinated environment. We'll give details on how we'll move into that new system and what will help us get there. On Tuesday, I'll be joined by Minister Henare to talk about the work we're doing to lift vaccination rates in our Māori communities. This work is absolutely critical. On Wednesday, Minister Hipkins will present the up-to-date advice on schools reopening. And on Friday, as I said, we'll release the details of the new COVID protection framework and how we'll get there. But for now, let's come to the alert level decisions. Today, Cabinet has confirmed that New Zealand, outside of those areas with level 3 restrictions, will remain at alert level 2. I'll come then to the decisions for Northland, the Waikato, and then Auckland. Let's start with Northland. With more than 16,000 tests undertaken since the first positive case, and testing across 19 wastewater sites, all returning negative results, all the evidence to date suggests the individuals who tested positive in Northland have not spread it further. I would, however, always ask anyone with symptoms to get a test and anyone still waiting to get a vaccination. On this basis, and on the advice of the Director General of Health, Northland will move to alert level 2 at 11:59 p.m. on Tuesday, the 19th of October. For the Waikato, the situation is different. While the cases remain broadly linked, this linking is often occurring after the positive results are being returned. I acknowledge the testing, more than 45,000, and vaccination efforts of those in the region beyond this, during this period. But as you will have seen, there have been further cases and some positive wastewater testing in the greater area, and so we need to act with caution at the moment. That is why Cabinet has decided to hold the Waikato at level 3. We will review these settings and update any change in position on Friday. And now to Auckland. Today is day 62 of alert level 4 or 3 in Tamaki Makaurau. That is a long time to have been living with restrictions. But those restrictions have made a huge difference. They've helped us to keep case numbers as low as possible while we continue to vaccinate people. And vaccinations continue to be so important, not just in the future, but right now. Only 4% of cases in this outbreak were people who were fully vaccinated. And of the 158 who needed hospital care, only 3 were fully vaccinated. But we need to keep going with both tools, our restrictions and vaccinations, because with Delta, we cannot rely on just one. If we get this right, if we keep case numbers low while we vaccinate people, then it makes it easier for us to keep control of COVID while we ease restrictions in the future. And that is everyone's goal. So the question for Cabinet today has been, how do we avoid a spike in case numbers and hospitalisations and protect vulnerable communities as much as possible in the coming weeks while we keep lifting vaccination numbers. First, it is important to remember that the Alert Level 3 rules in Auckland are currently the toughest restrictions in place anywhere in the OECD at the moment, according to the Oxford Stringency Index. These are not soft rules. Despite that, a number of respected scientists and epidemiologists have suggested a return to Level 4 for a defined 2-week lockdown to act as a circuit breaker and limit the number of cases while our vaccinations take hold and strengthen our immunity. However, the public health advice, including from teams on the ground and from Dr. Ashley Bloomfield, is that 2 more weeks at Level 4 is unlikely at this stage to reduce the number of cases significantly because of the nature of the outbreak and the fact that compliance has been an issue. We considered both sets of advice carefully. Cabinet has to take into account a range of factors, including the overall well-being of Aucklanders and how hard this period has been. But the consideration that stood out for us the most was the view amongst those closest to the outbreak that this increase in restrictions would not necessarily reduce cases significantly more than the Level 3 restrictions we already have. So the next question is, what can we do at Level 3 to minimise cases as much as possible? The first thing Cabinet has decided is that Auckland will remain at Alert Level 3 and with the current restrictions already in place, and that we will do that for the next 2 weeks. Based on the advice we have, any interim easing of Level 3 restrictions over the coming weeks will not work towards our plan of minimising cases while we increase vaccinations. But the biggest thing that will make a difference right now, alongside vaccines, is asking that everyone continue to comply with the restrictions that are already there. In particular, the alert level rules around indoor gatherings. They are not allowed. They are a risk to you and those around you, and they are one of the most significant causes of ongoing spread in this outbreak. And no one is in an area where the rules don't apply. We now have cases in 124 suburbs. They are across the entire geographical spread of Auckland. That means everyone, especially those who are unvaccinated, continue to be at risk of getting the virus regardless of what suburb you live in. So a reminder on the rules at Level 3. They are there to help us for this critical phase. Please stick to your household bubble. The only social catch-ups that are allowed have to take place outdoors because the natural ventilation of fresh air reduces the risk of passing on the virus. We ask that you be masked and distanced with no more than 10 people from 2 households at any one time. Indoor gatherings, parties, social catch-ups, they're not part of Level 3. And it's one of the things we cannot afford to let slip. I know this is hard, and I want to acknowledge the ongoing impact, in particular on Auckland business, of staying at Level 3. We've heard the call from the Auckland business community for additional support given the extended period of restrictions. Minister Robertson is currently working on an enhanced business support package for Auckland, and we'll be in a position to share more of the details of this on Friday. And finally, a quick preview to the announcements on Friday. When we come to outline the new COVID protection framework, we will establish a vaccination target, or as Dr. Bloomfield calls it, a milestone, for Auckland and New Zealand in order to move into that framework and to start easing restrictions. The target will be high to give us the greatest confidence possible. We've looked closely at the evidence overseas and what works and what doesn't. We'll be aligning our target with those countries that have managed the transition from restrictions to vaccination in the safest way possible. But regardless, we hope that this will give Aucklanders especially as much certainty as possible about what lies ahead, and importantly, a goal that we can all rally behind. So in summary, our plan is as follows. Auckland will stay at Level 3 with no further changes to the Level 3 settings at this stage. This is the best way to continue to suppress and minimise cases while we work towards high rates of vaccination. These settings will remain for 2 weeks. On Friday, we'll set out the new protection framework, a plan to continue to protect New Zealanders from the virus, and it will include a vaccination target to meet before moving into that framework. I have one final message. On Super Saturday, we saw what was possible. The vaccine is all about opening up opportunities and easing restrictions. Just as we smashed our target of 100,000 vaccines on Saturday, we know that when we set a goal, we can reach it. We're making great steps forward, and there is a way through. New Zealand can be one of the few countries in the world to get to high rates of vaccination without the human and economic carnage it has inflicted on so many other countries. It is possible, and I know we can do it.